We are working with spiral stabilization method, and today I would like to talk about treatment of intervertebral disc herniation. That's our clinic in Prague when we produce therapy, and we are teaching courses for trainers, physiotherapists, and medical doctors how to treat a disc herniation. Discus intervertebralis, or intervertebral disc, has two parts. On the surface is annulus fibrosus, and this is very strong connective tissue system of oblique fibers, and the same oblique fibers we can find on the surface of our body, like trapezius or latissimus dorsi. Nucleus pulposus is a system of liquids in the middle of the disc and give us the flexibility. Then we need this middle full of fluids and to be possible to move. Internal organs like intestines, stomach, and so on are in the middle of the body. Then in the middle of the body, we have the same system like nucleus pulposus, and on the surface, we have system of muscle fibers like annulus fibrosus. Then we have on the surface on our body system of muscles. They stabilize the body in this spiral muscle system. This spiral muscle system create full muscle corset, and this corset stabilizes our body, and this is the most important principle of treatment of troubles of the disc. We have the system of exercises that activate muscles between shoulder blades like trapezius and connected to oblique muscles in abdominal wall. It is in front. And next connection is to gluteus maximus. And so we can activate spiral muscle system through training. And training of muscle chains, they stabilize our body. We have this exercising program in our DVD. And on this DVD, we have exercising program with commentary. Then now we prepare it in English language too, and you can exercise, and I tell you how to fix the shoulder blade, how to work with your gluteus and correct the position of the pelvis, how to correct your head. And when we start to breathe in, this is the first position over there, and now we breathe in, and now through the activity of spiral chains, we should breathe out, and this exhaling improve the stability of abdominal wall. Then the first position in this exercising program is stretch of erector spinae, and the second position, stabilize shoulder blade and create spiral muscle chains. They stabilize our body and they regenerate the spine. Then spine has two positions. Front position is stretch, and the second position is stabilize. And the stabilization connect shoulder blade activity, abdominal wall activity, and gluteus activity. Then we create spiral muscle chains, muscle corset. We can use the same by patients. They have disc herniation, and through long-term exercising every day, 3 times during the day, we can completely treat this herniation. This herniation in spinal channel squeeze spinal cord, and we should completely open this space again, approximately 1 millimeter 1 month, then this herniation need approximately 1 year to be completely resolved. But first 3 millimeters are very important, because after these 3 millimeters, approximately 3 months, we are usually pain-free and without any troubles with the nerve compression. This evolution of this herniation is so. First, we have pressure on the disc, and we reduce the fluids. Then fluids are white in spinal channel liquor, and the white color show we have enough fluids in the disc, but this disc is black. Then black disc is the first step of degeneration. Second step is this open space between nucleus pulposus and the lateral side of the disc. Then this bind point is a communication with nucleus pulposus and the surface. After that, last overusing of our spine create this disc herniation, but through exercising program we can completely treat it. First situation is this white tissue behind ligamentum longitudinale posterius, or the ligament. It is in the back side of the vertebral body, and this is this herniation. This is completely treatment. Then once more, first step of degeneration is black disc, and this hyperintensive zone, then white fluids point, then show there is a communication, and we have troubles in our disc, then rupture of the surface of the disc, then annulus fibrosus. We can see this rupture very good on this model. Then nucleus pulposus has a communication to the last millimeter, and next overusing, we pick up something heavy, or we use some sport, and after that we create this herniation. We can treat this situation very good in fitness center with some program of group exercising, but should be very good coordinated, then good educated fitness trainer. This herniation we start to treat with doctors and physiotherapists, and after that we continue with trainers, educated trainers. Sure, are welcome chiropractors in our courses. This is full resorption of this herniation, and I have some examples before disc herniation and very good improvement. We see on the side view. The same is here. Next patient, the nerve is not visible, and this nerve root is again free. Then this is paralyzing, and this is now free new motion. This disc herniation is very big one and very good resorption. Lateral view show again very good treatment of this herniation. This is another one, and again good results. And another disc herniation with good therapy results. Then it is necessary to show once more. We have oblique muscle fibers in our abdominal wall, obliquus externus, obliquus internus abdominis, transversus abdominis, and the same fibers, the same direction of fibers we can find in our intervertebral disc. Then through oblique muscles, not straight, but oblique muscles, we can stabilize the body, create power up, and regenerate or treat the disc troubles. Then exercise program. Then when we use oblique fibers in our abdominal wall, through spiral chains, we can treat disc herniation. And again, we have the same exercise 2. We have approximately 150 exercises. But 11 exercises are the most important, and this is program for everybody to do it at home. Then DVD with first position, last position, and video, and there is all explanation what we are doing. Then this is head position correction. We go in the front position and we stretch erector spinae, or erector spine, if you like to use English pronunciation. Now we stabilize shoulder blade and we have stability in abdomen wall. And sure, it is necessary to use the gluteus maximus for stabilization of the pelvis. Then home program to exercise. I recommend to use this DVD for regeneration, but for therapy we need a control of educated physiotherapists, chiropractors, or very good educated trainers in rehabilitation sport. Rehabilitation sport is therapy in individual or group exercising with very good control of the quality of exercising. This is the system of our courses. We use it in Prague. You see 2 mirrors, then give me possibility to control my position of my arms, of my pelvis, of my shoulders, and this is the control of quality, and we can exercise together with a group approximately 18 people maximum. Courses are in Czech language, German language, English language, and some of them when we have possibility to travel in Chinese language. We have the course 1, introduction, training, coordination, and prevention. Lumbar thoracic spine is, and this herniation is course 2. 2 times 4 days, maybe we can join it together in 1 week exercise program. Upper, lower extremities are next course, and muscle chains, detailed anatomy is there, but in the first course we have sure muscle chains, basic education too. We can treat very good scoliosis, sure it will be the next our presentation. Vertebral-visceral relationships then means program for heart, lungs, and headache, and so on. Sport, we use our system for sport. Training and improve our running, and sure treat all the overusing from the sport. We have course for teachers, and when you have 8 courses, you can be a teacher of method and you can do it in all the world. And we can repeat this exercising. This is very important to do it properly and without mistakes. We have courses for manual and massage therapy. This is in every course 1 till 8, but we can repeat it. And we have course to read properly X-ray, MRI, or computer tomography, and create the structural diagnosis for our clinical use than for our rehabilitation plan. If you are interested in this system, you can meet us in Prague or Brno, another big town in Czech Republic. But we are traveling in all the world, all the Europe, then Germany, sure, Switzerland, and in English-speaking countries, then England and Sweden and Finland and Korea and China. Then if you are interested about thinking you have some question, we have email, we are speaking English, then it is possible to call us, and I hope if you have interest, we can meet somewhere in our courses. Thank you for your time and see you somewhere in the world.